Hanna. So I just want to ask you, like you said, you have lower back pain, right?
Yeah.
Tell me a little bit about the back pain. Describe me what's exactly going on there.
So it just feels kind of like it's burning, a burning sensation down here. And it hurts a lot when I'm standing up for a long time, when I wash dishes. Yeah.
Okay. So for how many years you had it for?
Probably 7+ years.
Okay. So we're just going to assess her back. Right now, first of all, I'm going to just kind of scan through this, and you can see, let's see here, definitely an increased kyphosis in there. Not too bad of a hump there, just a very mild version. And you go coming down the spine. Do you get pain around here as well?
Yeah.
Yeah. Just in the transition segment between the lumbar and thoracic spine, you can see definitely she's struggling there. Okay, there you go. So her right SI joint. So definitely she said her right SI, she has more hip pain on the right side. Her SI joint is off. I'm going to check it also after when she's lying down, but I'm going to first do the sEMG scan, and then from there we'll go ahead, okay? So you can actually turn this way. Good. Yeah, this is the, okay. This is the area you said it's pretty bad, right?
Yeah.
So when you were standing, this SI joint was actually pretty stuck, but the minute you lie down, this one's worse, okay? So I'm gonna have you bring your hands down, okay, and just rest it on the armrest. Okay, any tenderness right there?
Yeah.
Take a nice deep breath in, and all the way in. One more time in and out. Look at that. The sun is shining through on your first adjustment. Tender?
Yeah.
Okay, so what I'm going to have you is this side up. So you're going to go lie down on your side. Take your time. There you go. Just a little bit down, dear. A little bit more. Good. Oh my God. There you go. It's your first chiropractic adjustment, right?
That's really good.
Okay, so you're gonna go back on your stomach. Okay, so this side up for me. Cross that again. Good. Take a nice deep breath in. And all the way out. Good. Good. Back on your stomach. Gonna feel a huge difference after this. Good. Drop your arms to the side. Let them drop on the floor. Good. Breathe in and out. Good. Release. Okay, so are you ready for the neck adjustment?
Yeah.
Okay, so I'll have you turn around on your back.
Okay. Oh my goodness. That was good.
So another one on the other side. Okay. It's her first adjustment, so she's a little bit tensed up there. And just relax yourself, breathe in and all the way out.
Good. Yeah.
So how do you feel?
I feel so much better. I feel more relaxed and loose.
Just take a nice deep breath in. Oh, very good. Let's integrate that. Allow the energy to move. Good. Keep going. It was wonderful to see you. See you on the next one.
Thank you so much.